Hi, I'm Dr. Alanna Nzoma with West Bloomfield Pediatrics, and I'm here to talk to you today about the flu vaccine. Just some background information. Flu is short for influenza, and the vaccine is to protect you against that illness. Influenza can cause serious disease, hospitalization, and even death, so it's a really important vaccine to discuss. The flu season in the United States is from October to May, so it's a pretty extensive part of the season. The flu vaccine is safe and effective and is approved for kids 6 months and up. Traditionally, there have been two types of flu vaccines, one being the mist, the other being the shot. The mist, however, has been studied, and the CDC and the American Academy of Pediatrics does not recommend the mist this year for vaccinating our children. It had previously been approved for ages 2 and up to protect against the flu. The issue is that it was studied in detail and found to be less effective than it was supposed to be, and so it's no longer recommended. It's also really important to get vaccinated against the flu every single year. I did mention that it kind of the virus changes every year, and that certain types are more common in one year than another year, and that's part of why you need to get vaccinated every year. The other reason is that your own immune system will have a decent level of immunity in the beginning of a year, but then as years go by, your level of immunity will go down. So most people are concerned that the flu is going to give you the flu. The flu vaccine was actually going to give you the flu illness. That is not possible. The flu vaccine, the shot, is made from a dead virus. It cannot give you flu symptoms. However, the things that people do see as side effects which can happen are fever, arm pain, redness, swelling in the limb or the site of injection. There is no conspiracy with Big Pharma making tons and tons of money and doctors getting money from patients getting flu vaccines. We are trying to promote flu vaccines because it's safe and effective and it helps to prevent the flu. Even if you have contracted the virus but don't have many symptoms, it's still possible for you to spread the flu. And that's really important when it comes to siblings, especially children in the household that are under the age of vaccination, for everyone in the household to get protection if they can. Pregnant women should also get the flu vaccine, as it can lead to very serious illness or death in pregnancy, and it can help actually protect the baby the first few months of life when the mother has actually gotten the flu vaccine during pregnancy. The vaccine that we have is the best way that we can prevent the flu from happening for our patients. The flu vaccine is not 100%, but it's as effective as it can be. A lot of people ask me, do I actually get the flu vaccine myself, or do I get it for my family? I do, and both my husband and I do, and both of our children get the flu vaccine every year. I do strongly encourage all of the patients at West Bloomfield Pediatrics to get the vaccine, to consider it. If you have questions or concerns, please talk to me or one of the other doctors so we can help address those issues. But it's a really good vaccine. It's the best we have. That combined with good hand washing can really make a big difference.